Betibeglogene autotemcel is used for treating a specific inherited blood disorder called beta thalassemia. When you have beta thalassemia, your body doesn't produce enough hemoglobin, a protein that carries oxygen to your body's tissues. This treatment, known as gene therapy, uses your own blood stem cells to make betibeglogene autotemcel, which has been modified to produce the necessary genes for proper hemoglobin production. This can potentially reduce or eliminate the need for regular blood transfusions. The daily dosage and optimal timing for this treatment will be determined by your healthcare provider. Before receiving Zynteglo, it's important to read the patient information leaflet from your pharmacist. Your doctor may also give you other medications, such as chemotherapy, before starting treatment with this product to prepare your body. Zynteglo is administered by slow injection into a vein as directed by your doctor. In order to reduce the risk of side effects, your doctor may provide you with other medications before administering betibeglogene autotemcel. The dosage of Zynteglo is determined based on your medical condition and weight. After receiving Zynteglo, you will need to stay in the hospital for about 3 to 6 weeks so your doctor can monitor your progress and help manage any side effects. This will allow your doctor to ensure that the treatment is working effectively for you. If you experience pain in the abdomen, arms, or legs, be sure to inform your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects. However, treatment with this product may lead to a low number of blood cells, which can cause anemia, decrease your body's ability to fight infection, or cause easy bruising/bleeding. Be sure to tell your doctor right away if you develop any unusual symptoms, such as tiredness, pale skin, signs of infection, or easy bruising/bleeding. Additionally, your doctor should do regular blood tests for at least 15 years to monitor for any changes to your blood. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction. Be sure to contact your doctor or pharmacist if you notice any other effects not listed above. Before starting Zynteglo, inform your doctor if you have any allergies or a history of infections, kidney problems, or liver problems. This medication can increase your risk of infections or make current infections worse, so avoid contact with people who have infections that can easily spread. Let your healthcare professional know if you have received this medication before getting any immunizations or vaccinations. Be cautious with sharp objects and avoid contact sports to lower the risk of injury. Before undergoing surgery, tell your doctor about all the medications you are using. If you are pregnant or planning to become pregnant, do not use Zynteglo. Both men and women using this medication should ask about reliable forms of birth control during treatment and for at least 6 months after the last dose. It is not recommended to breastfeed while using this drug. Always consult your doctor before making any decisions regarding pregnancy or breastfeeding. When taking Zynteglo, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. In addition, certain medications such as antiretroviral drugs and hydroxyurea may interfere with the production of Zynteglo. If you are using any of these medications, your doctor may have you stop taking them for at least 1 month before receiving Zynteglo. Furthermore, Zynteglo may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this medication. If someone has taken too much Zynteglo and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Before you receive Zynteglo, your doctor may perform lab and medical tests such as complete blood counts. It's important to keep all your medical and lab appointments. After receiving this treatment, it is important not to donate blood, organs, tissues, or cells. This is to ensure the safety of both the donor and the recipient. Zynteglo is a gene therapy used to treat patients with transfusion-dependent beta thalassemia, a rare genetic blood disorder. It is used to increase the production of hemoglobin in the blood, which helps reduce the need for blood transfusions. The recommended dosage of Zynteglo is 1 to 2 x 10 exp 6 cells/kg body weight, administered as a one-time infusion. It is important to discuss the optimal timing for the infusion with your healthcare provider. The benefits of Zynteglo include a reduction in the need for blood transfusions and improved quality of life for patients with beta thalassemia. This treatment is administered in a medical facility and is not meant to be stored or used at home. It is important to follow the instructions of your healthcare provider regarding the administration of Zynteglo. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.